Today we are going to learn how to give your IV antibiotic using the IV push method. Begin with a clean surface, washing the area with a clean hand towel with soap and water or a disinfectant wipe. You can also use your visual teaching mat as your work surface, but remember to clean and disinfect before each dose.
Next, wash your hands well for at least 20 seconds. Apply enough soap to cover the entire surface of your hands, using enough friction to really get them clean. Making sure you have a clean area and clean hands during every step is very important to prevent infection. If you don't have access to soap and water, use an alcohol-based hand sanitizer. Rinse them well and dry with a paper towel or clean hand towel, and use that same towel to turn off the faucet.
Next, make sure you have all of your supplies ready to go on your teaching mat. You will need your medication syringe, 2 pre-filled saline syringes, alcohol swabs, and an alcohol protective cap. Remove all the wrappers from the saline syringes. Prepare your saline syringes by removing any air. Start by holding the saline syringe with the tip pointing up. Tap on the syringe barrel to move the bubbles to the top of the syringe. Next, loosen the white cap with a half turn and firmly pressing on the plunger until you see a drop of fluid. Retighten the cap before placing it back down. Do this with both saline syringes. If you touch anything else other than your supplies, you should wash your hands again or use an alcohol-based hand sanitizer. Remove the green cap from the clave connector. Clean the clave connector on the pick with an alcohol swab for 15 seconds. Be careful not to touch the tip of the clave connector with your hands. If you think you have contaminated the clave connector, go ahead and clean with a second alcohol swab. Carefully remove the white cap from your saline syringe. Holding on to the ridged edge of the clave connector, attach the syringe using a push-twist motion. If you notice air in the saline flush, tip the syringe with the plunger side up and tap the barrel with your finger so the air moves to the plunger end. Flush the catheter with 10 mL of saline. If you notice air, stop at the 1 mL mark, just shy of injecting the air bubble. Holding on to the ridged edge of the clave connector, remove the syringe with a slight twisting motion. Clean the clave connector again with an alcohol swab for 15 seconds. And be careful not to let the tip of the clave connector touch anything else. Now you're ready to administer your medication. Remove the cap from the medication syringe tip. Push the syringe onto the clave connector using a push-twist motion, making sure it is secure. Then slowly push the plunger to administer the medication in the amount of time that you were instructed. We recommend using a watch or timer to properly administer your medication over the prescribed time. Once the medication is in, remove the syringe from the clave connector with a slight twisting motion. Clean the clave connector on the pick with an alcohol swab for 15 seconds. Be careful not to touch the tip of the clave connector with your hands. If you think you may have contaminated the clave connector, go ahead and clean with a second alcohol swab. Carefully remove the white cap from your saline syringe. Holding on to the ridged edge of the clave connector, attach the syringe using a push-twist motion. If you notice air in the saline flush, tip the syringe with the plunger side up and tap the barrel with your finger so the air moves to the plunger end. Flush the catheter with 10 mL of saline. If you notice air, stop at the 1 mL mark, just shy of injecting the air bubble. Holding on to the ridged edge of the clave connector, remove the syringe with a slight twisting motion. Lastly, apply the green cap to the clave connector. You do not need to clean with an alcohol swab prior to this step, as the green cap contains alcohol. Go ahead and throw the used alcohol swabs, caps, and syringes in the regular trash. Clean your teaching mat and put it away for next time. If you have any questions or concerns, please call the Home Infusion Therapy Department and we'd be happy to help you. Thank you for watching. General information. Change tubing every 24 hours. Use new syringes with each flush of sodium chloride. Never flush your line with water. Use new alcohol swabs with each cleaning of the clave connector. Never use hot water or a microwave to warm your medication. If you are unable to flush your PICC, do not force it. This could cause the line to rupture if you push too hard. Try to change the position of your arm. Check for kinks or a closed clamp if your line has one. If you're still unable to flush, call your physician or their nurse. A nurse will change your PICC dressing once a week, and that's usually done at your clinic appointment. Keep your PICC dressing and tubing dry. Cover with plastic when bathing or showering, using saran wrap, cling wrap, an old bread bag, or any clean plastic covering, and make sure you tape all the edges of the covering well to prevent it from getting wet. Do not submerge the site. If you accidentally remove the clave, do not put the original one back on. Open the new clave from the sterile packaging. Leave it sit in the packaging. Clean the end of the line with a new alcohol wipe. Hold on to it, not letting it touch anything. Untwist the blue protective covering from the new clave, being careful not to touch that area or the end of the line that you cleaned with alcohol. Twist the new clave onto the end of your line. You are now ready to reinfuse your medication. If your clave connector needs to be changed for any reason or you have any questions, please call for instruction. Notify your physician or nurse if you have fever, chills, redness, drainage, or leakage at the PICC site. If your dressing becomes wet or soiled under the clear bandage, it must be changed immediately. If the clinic is open, you can go there. There is also someone always available at the hospital to change your dressing or at your nearest healthcare facility. You may move your arm freely, but do not keep the arm bent at the elbow for extended periods of time. If your line gets pulled on or is pulled out from the insertion site, do not push it back in to how it was before. Secure it the best you can with the tape and come into the healthcare facility nearest to you to have the line assessed, as it may need to be replaced. If you have any questions, please call Home Infusion Therapy Department and we'll be happy to help you. Thank you for watching.